7 Key Morning Indicators of Diabetes. Recognizing the signs for improved well-being. Good morning. Consider the possibility that you may be unknowingly overlooking subtle, yet crucial indicators of your body's health. A significant percentage of individuals with prediabetes, as high as 80%, remain unaware of their risk. Recognizing these early warning signs is paramount, as early detection can significantly impact your future well-being. This video will explore 7 key morning indicators of diabetes, knowledge of which can be instrumental in safeguarding your health. Join us as we delve into this important topic, empowering you to take proactive steps towards a healthier life. Dry mouth and excessive thirst. Upon waking, you experience dry mouth, a sore throat, and intense thirst. Despite drinking plenty of fluids, the thirst persists, leading to frequent water consumption. This is often by high blood sugar, hyperglycemia. Elevated blood glucose triggers the body to eliminate excess glucose through the kidneys, a process known as glycosuria. This results in increased nighttime urination, nocturia, and significant dehydration, as the body requires water to dilute the excess sugar. Insulin resistance further contributes to this, as the body's cells don't respond effectively to insulin, causing glucose to accumulate in the blood. This puts pressure on the kidneys, prompting increased fluid excretion to reduce blood sugar levels. Electrolyte imbalances also play a role. Each urination not only depletes water, but also crucial electrolytes like sodium and potassium, exacerbating dehydration and intensifying thirst. However, understanding these mechanisms allows for effective management and relief. Disrupted sleep. Frequent nighttime awakenings to urinate can interrupt sleep, leading to daytime fatigue. Chronic dehydration. Inadequate water intake can cause cellular and tissue dehydration, impacting organ function, particularly the kidneys and brain. Reduced risk of complications. Early detection and management of dry mouth and thirst can help prevent serious kidney complications or diabetic ketoacidosis, DKA, a life-threatening condition. Medical examination. Fasting blood glucose and HbA1c tests will assess current and average blood sugar levels over the past 3 months. Kidney function and electrolyte levels will also be checked. Lifestyle modifications. Diet. Reduce intake of sugary and starchy foods and increase fiber-rich foods. Hydration. Maintain adequate hydration, avoiding excessive fluid intake which can disrupt electrolyte balance. Physical activity. Regular exercise improves insulin sensitivity. Symptom monitoring. Record the frequency of nighttime urination and the severity of dry mouth and thirst to provide valuable information for your doctor. This comprehensive approach offers a positive path towards improved health. 2. Blurred vision. Upon waking, you may experience blurry vision, difficulty focusing, or a general sense of impaired sight. While these symptoms may be temporary and improve throughout the day, their recurring nature in the mornings warrants attention. However, this is often easily addressed. Elevated blood glucose and its impact on the eye lens. Mechanism. High blood sugar levels cause glucose to enter the eye's lens. The lens absorbs water to dilute this glucose, altering its shape and curvature. This affects the eye's focusing ability, potentially causing blurred or tired vision. Temporary effects. Symptoms often improve with blood sugar control. However, prolonged high blood sugar can lead to lasting damage. Damage to small blood vessels. High blood glucose damages the tiny blood vessels, capillaries, nourishing the retina, potentially causing retinal swelling or leakage. This may begin with morning blurry vision and progress to more serious vision problems, such as diabetic retinopathy. Dry eyes. High blood sugar can reduce tear production or alter tear quality, leading to dry eyes and impaired moisture retention. This increases discomfort and blurry vision. Increased eye pressure. In some cases, persistently high blood sugar may increase the risk of glaucoma, raising pressure on the optic nerve and causing vision problems, particularly noticeable in the mornings. With proper management of blood sugar levels, many of these vision-related complications are preventable or manageable. Frequency. Blurred vision occurs repeatedly, particularly in the mornings after waking. Symptoms may improve throughout the day, but recur frequently. Associated symptoms. This is accompanied by other symptoms of diabetes, such as thirst, frequent urination, or fatigue. Unrelated factors. The blurred vision is not attributed to common causes such as sleep deprivation, prolonged computer use, or myopia. 3. Morning hyperglycemia, dawn phenomenon. Elevated morning blood glucose levels, particularly upon waking, even before consuming any food, are sometimes experienced. This may be accompanied by feelings of fatigue, thirst, or even blurred vision immediately upon waking. However, effective management strategies are available to address this. Hormone release at dawn. Between 3 to 8 a.m., the body naturally releases hormones such as cortisol, which boosts energy for the day ahead, growth hormone, which aids in tissue repair and building, and adrenaline, which enhances alertness and metabolism. These hormones stimulate the liver to release glucose from glycogen stores into the bloodstream, providing energy. Insulin resistance or deficiency. In healthy individuals, sufficient insulin is secreted to balance glucose release. However, in those at risk of or with diabetes, insulin resistance, where cells don't respond well to insulin, hindering glucose absorption, or insulin deficiency, where insufficient insulin is available to process the surge in glucose, can lead to elevated blood sugar. Increased glucose production by the liver. The liver may excessively release glucose into the bloodstream in response to hormonal signals, exacerbating high blood sugar levels. Fortunately, understanding these processes allows for proactive management and improved health outcomes. Morning blood glucose monitoring. Use a glucometer to check your glucose level immediately upon waking. If your morning blood sugar is unusually high, no 130 milligrams per deciliters, despite not eating the previous night, this may indicate the dawn phenomenon. Accompanying symptoms may include thirst, fatigue, or other signs such as increased urination at night. Unlike the Somogyi effect, the dawn phenomenon involves a rise in blood glucose due to hormonal changes. The Somogyi effect, conversely, is a rise in blood glucose following nocturnal hypoglycemia caused by excessive insulin or skipped meals. Blood glucose monitoring. Record your blood glucose levels before bed at 3 a.m. and upon waking to identify any overnight increases. Consider using a continuous glucose monitor, CGM, for more comprehensive tracking. Dietary adjustments. Consume a low-carbohydrate dinner, especially before bedtime. Avoid high glycemic index (GI) foods in the evening, as these can elevate nighttime blood glucose. Lifestyle modifications. Exercise. Gentle exercise in the afternoon or evening can improve insulin sensitivity. Prioritize sleep. Insufficient sleep can increase cortisol levels, exacerbating the issue. Medical consultation. If you consistently experience elevated morning blood glucose levels, consult your physician for potential adjustments to your medication or insulin regimen, particularly before sleep. 4. Morning fatigue. Waking up feeling fatigued and drained, despite sufficient sleep, is a common experience. This fatigue extends beyond simple sleepiness, encompassing both physical and mental lethargy. Some individuals may also experience a sense of mental fogginess or difficulty concentrating. However, understanding and addressing the underlying causes can lead to improved energy levels and overall well-being. Energy metabolism dysfunction. The role of glucose. Glucose is the body's primary energy source. However, when blood sugar levels are excessively high due to diabetes or insulin resistance, the body cannot utilize glucose effectively. Insulin resistance. Cells receive insufficient glucose due to insulin resistance, despite high blood glucose levels. This leads to cellular energy starvation. Result: the body experiences fatigue because organs and cells lack sufficient energy. Impact of overnight hyperglycemia. Elevated nighttime blood sugar necessitates increased bodily effort to process glucose, disrupting sleep cycles, reducing sleep quality, and causing morning fatigue. Dehydration and electrolyte imbalance. High blood sugar stimulates frequent urination, glycosuria, leading to dehydration and the loss of essential electrolytes like sodium and potassium. Chronic dehydration impairs alertness and contributes to persistent fatigue. Hormonal imbalance. Ineffective insulin function, coupled with increased morning cortisol, stress hormone, affects the body's energy regulation. Chronic inflammation. Sustained high blood sugar triggers chronic inflammation, reducing cellular function and causing fatigue. However, with proper management and treatment, these challenges can be effectively addressed, leading to improved energy levels and overall well-being, reduced productivity and quality of life. Persistent morning fatigue impacts work, study, and daily activities, potentially leading to feelings of frustration and decreased motivation. However, addressing this allows for improved well-being and increased engagement in life's activities. Mitigation of health risks. Fatigue can signal serious metabolic issues. Timely intervention can prevent complications such as cardiovascular disease, nerve damage, and kidney problems. Improved mental well-being. Addressing persistent fatigue positively impacts mood and reduces the risk of anxiety and depression, paving the way for a more fulfilling and balanced life. Key indicators include persistent fatigue despite adequate sleep, accompanied by symptoms such as dry mouth, frequent urination, and thirst. Elevated morning blood glucose levels, above 130 milligrams per deciliter, coupled with fatigue, may indicate early metabolic dysfunction. While fatigue may be prevalent in the mornings and persist throughout the day, positive improvements are possible with appropriate management. 5. Morning headaches. Awaken feeling refreshed with a mild, throbbing, or tension headache that may be localized to the forehead or the back of the head, or may be more generalized. These headaches may be accompanied by other symptoms such as fatigue, dry mouth, or dizziness, all of which are typically manageable. Unstable blood sugar levels, high or low blood sugar. Hyperglycemia, high blood sugar. When blood sugar rises, the blood thickens, increased viscosity, slowing circulation and reducing oxygen flow to the brain. This results in headaches due to insufficient blood and oxygen supply to brain tissue. Hypoglycemia, low blood sugar. If blood sugar drops too low at night or early morning, the brain doesn't receive enough glucose, its primary energy source, causing headaches. This can occur due to diabetes medication, high insulin doses, or skipping meals. Dehydration. High blood sugar causes dehydration. As the kidneys work to eliminate excess glucose, you urinate more frequently, glycosuria, leading to dehydration. Dehydration affects blood circulation, reducing pressure in the brain's blood vessels and causing headaches. Morning hypertension. High blood sugar can increase blood pressure, especially in the morning due to the dawn phenomenon, increased cortisol and adrenaline hormones. Increased pressure in the brain's blood vessels can trigger headaches. Chronic inflammation. Prolonged high blood sugar causes inflammation of small blood vessels and nerves, including those involved in pain sensation, leading to chronic headaches. Poor sleep quality. Sleep apnea. People with diabetes have a higher risk of sleep apnea, which reduces blood oxygen levels. Low oxygen causes dilation or constriction of brain blood vessels, leading to morning headaches. Sleep disruption. Frequent nighttime urination or overall fatigue can disrupt sleep, resulting in headaches. Fortunately, managing blood sugar levels effectively can significantly reduce the frequency and severity of these headaches. With proper treatment and lifestyle adjustments, individuals can experience improved sleep quality and a reduction in headache occurrences. Morning headaches. Often occurring upon waking, these headaches may be accompanied by thirst, blurred vision, or fatigue. The headache may last for several hours, often improving after hydration or breakfast. Blood glucose levels. Elevated morning blood glucose levels, 130 milligrams per deciliter, or hypoglycemia, 70 milligrams per deciliter, can be contributing factors. Frequency and recurrence. These headaches frequently occur in the mornings, particularly when sleep is disrupted or dietary habits are irregular. However, with proper management of blood sugar and sleep, these episodes can be significantly reduced. 6. Morning nausea. Morning nausea or gastric discomfort unrelated to food intake may be experienced upon waking. This may be accompanied by fatigue, thirst, or dizziness. However, these symptoms are often manageable and treatable. Diabetic ketoacidosis (DKA). Mechanism. When the body lacks sufficient insulin, or insulin is ineffective, glucose cannot be metabolized for energy. The body then utilizes fat, producing acidic ketone bodies as a byproduct. Effects. Ketone accumulation in the blood alters pH, disrupting chemical balance and causing nausea. This may accompany other symptoms such as extreme thirst, frequent urination, fruity-smelling breath, and even loss of consciousness. Blood glucose imbalance. Hypoglycemia. When blood glucose levels drop too low, particularly at night or early morning, the brain lacks sufficient glucose for optimal function, leading to dizziness, nausea, and sweating. Hyperglycemia. Elevated blood glucose disrupts the digestive system, causing nausea. High blood glucose also increases osmotic pressure, leading to dehydration and impacting gastric function. Gastroparesis. Mechanism. Long-standing diabetes can damage the vagus nerve, which controls gastric emptying. This slows digestion, causing bloating, nausea, or morning vomiting. Presentation. Nausea often persists after meals, accompanied by fullness or stomach pain. Dehydration and electrolyte imbalance. Frequent urination due to high blood glucose causes dehydration and electrolyte, sodium, potassium imbalance. This can result in nausea, dizziness, and weakness. Morning hormone surge, dawn phenomenon. The increase in hormones like cortisol and adrenaline in the early morning can elevate blood glucose and trigger nausea, especially in individuals with insulin resistance or poor glycemic control. Accompanying symptoms. Nausea may be accompanied by thirst, dry mouth, fruity-smelling breath, or frequent urination. Other symptoms such as fatigue, unexplained weight loss, or numbness may also occur. Blood glucose monitoring. Abnormally high morning blood glucose levels, 250 milligrams per deciliter, may be associated with nausea. The presence of ketones in the blood or urine indicates diabetic ketoacidosis, DKA. Frequency and timing. Nausea may recur in the mornings or after carbohydrate-rich meals. 7. Tingling and numbness. Experiencing tingling, numbness, or a pins and needles sensation in your hands, feet, or toes upon waking may be a temporary or persistent condition. Fortunately, these sensations often subside with gentle movement. Diabetic neuropathy. Mechanisms and manifestations. High blood sugar levels damage the small blood vessels capillaries supplying nerves, leading to impaired nerve function and symptoms such as numbness or tingling. This typically begins in the extremities, hands and feet, gradually progressing proximally, glove and stocking distribution. Damage to the myelin sheath, which protects nerves, occurs due to chronic inflammation or glucose toxicity, disrupting nerve signal transmission. Poor circulation results from damaged blood vessels. High blood sugar injures the vessel lining, impeding blood flow, particularly to the extremities. Reduced blood supply deprives tissues and nerves of sufficient oxygen, causing numbness. Furthermore, diabetic plaques can narrow arteries, further compromising circulation, especially during prolonged periods of rest, such as at night. Chronic inflammation, triggered by uncontrolled blood sugar, activates inflammation in the peripheral nervous system, exacerbating nerve damage and tingling sensations. While temporary nerve compression from sleeping positions can affect anyone, individuals with diabetes experience prolonged symptoms due to pre-existing nerve damage. Diabetes increases the risk of carpal tunnel syndrome, where compression of the median nerve in the wrist causes numbness and tingling in the fingers, often more pronounced in the mornings. However, with proper management of blood sugar levels, these symptoms can be effectively mitigated and overall nerve health improved. Numbness and tingling. This often presents in the extremities, such as the toes, feet, fingers, and hands. Symptoms may be more pronounced in the mornings following periods of inactivity. Associated symptoms. Numbness may accompany other symptoms of diabetes, including thirst, fatigue, or unexplained weight loss. Duration. If numbness is frequent and unrelated to temporary pressure, such as awkward sleeping positions, it may indicate diabetic nerve damage. However, early diagnosis and management can help mitigate the effects of this condition. You have accessed valuable insights that could significantly improve your well-being or that of a loved one. These 7 warning signs are not coincidental. They represent your body's crucial call for attention. Heed them carefully. If you found this video beneficial, please like and share it with your network. Subscribing will ensure you receive further health advice. Remember, proactive health management is paramount, and it begins with you. Maintain your well-being. Stay informed, and I look forward to seeing you in our next video.